Now, it's being called a crisis within a crisis, and we're talking about the growing backlog of patients awaiting surgery as all non-emergency operations and procedures are currently at a standstill. City News reporter Shauna Hunt looking into all of these numbers and also some of the stories behind all of these numbers, and it's heartbreaking. Good morning, Shauna.
Yes. Hey, good morning, Mel. You know what? This really is a tragic story. A man named Andy, he reached out to me back in January after his wife's kidney cancer surgery had been delayed 3 times due to a lack of ICU beds. Now, the operation eventually went ahead after about a 4 to 5 week delay, but sadly, shortly after, she passed away. Now, Andy can't say for sure if this delay contributed to her death, and doctors also can't say either way. But watching the third wave rise and the enormous strain on our healthcare system, Andy felt compelled to speak out and tell their story.
I look around and seeing what people are doing now and what the governments are doing, and it's not enough. And there are a lot of people that are dying from COVID, but there's also a lot of people that are passing indirectly because of it. I really am concerned about the people who are going to go through what we went through and possibly not even be able to get a bed. I mean, that's just tough.
Now, Mel, right now, the most time-sensitive cancer surgeries are going ahead while the other patients are being triaged. They're being cared for through other treatments, but you can only defer a cancer surgery for so long. I also spoke to a doctor who heads up the medical division of Ontario Health, and he talks about the magnitude of the situation.
About 1,200 cancer surgeries that are done every week on average. That number appears to be roughly halved.
At this point, how long are surgeries being deferred for? Is it just a matter of a week or two, or is it longer? Is it unknown at this point?
I think it's unknown, but in general, it would be dependent really totally on where the pandemic wave crests. I've had to tell my patients that the procedure that they were booked for is now put off, and we can't even give them a new date.
All right, Shauna, just out now from the Ontario Hospital Association, I want to bring in these numbers. 881 patients with COVID-related critical illness in hospital, as well as pediatric ICUs. 54 new admissions yesterday. And these numbers, sadly, I believe the threshold was in the 300s, right, when they said they're going to need to change procedures. And it's not just cancer patients that are seeing a wait because of the surgeries here. Who else are we looking at?
Okay, so Mel, the doctor you just heard from, Dr. Chris Simpson, he's a cardiologist. So, you know, heart procedures, hip replacement, knee replacement, cataract surgeries, these are people who are living in pain. And these are people who, these operations are supposed to give them a better quality of life. And now they're left, waiting longer. And who knows when they're going to get those surgeries. And Mel, just to put this into perspective, when hospitals were told to ramp down surgeries, Humber River, for instance, went from 18 operating rooms down to 2, maybe 3 a day.
Yeah, and it's horrible to hear all of these stories and people losing family members right now. Shauna, looking forward to hearing more on your story tonight. City News at 5 and 6 and citynews.ca. Thank you. 8:09 is your time right now. We're going to check upstairs with Steph to see what's going on in the traffic department. Steph, good morning to you.